Utah resident. His name is Mark Jorgensen.
It feels good. It does. That was kind of cool to fly over that desert and see those mountains and land. And yeah, it felt good to be home.
Well, breaking news tonight. Right now, we have learned the Utah man who contracted coronavirus on a Japanese cruise ship is back in Utah. Health officials with the Intermountain Medical Center made the announcement tonight, making this the first person with the virus to step foot in our state.
Yeah, but they are very clear to point out here he did not get the virus in Utah and say he is under tight isolation.
Now, tonight we're taking a closer look at what we can do right now to stay safe if an outbreak does happen here. We have live team coverage with our news specialist, Dan Rascone, stopped at a local emergency preparedness company where business is booming. KSL investigator Matt Gephardt's looking at the impact on our financial health. We begin with Alex Cabrera, who in a KSL exclusive has reaction from the patient, Mark Jorgensen. Alex?
Yeah, Dave Jorgensen is now here at Intermountain Medical Center in Murray. He got here just a few hours ago. He's someone that we have followed and spoken with for the past 2 weeks, but it was always either in that Diamond Princess cruise ship room or in quarantine at a military base in California. But now he is here in Utah, and even though he tested positive for coronavirus, he says he feels fine.
I'm feeling just fine. I don't have any symptoms, never have.
That's Mark Jorgensen from his isolated hospital room at Intermountain in Murray. Even though he's not showing any coronavirus symptoms, he did test positive for it. And since Intermountain is equipped to treat him, he decided to come home to be closer to family.
It's definitely more of a hospital feel than the other rooms I've been in, actually, even. And they've got me monitored. I'm tethered with.
Part of the reason the Centers for Disease Control allowed him to be transferred to Utah is because Intermountain is one of the few hospital facilities in the country able to do so. He will be in isolation in a self-contained unit with its own entrances and independent water and air filtration.
It's one step closer. I'm just kind of taking it a step at a time. I got out of Japan and I got into Utah, so hopefully the next stop will be St. George.
This unit in particular has not only the capability structure-wise and equipment-wise to take care of individuals with communicable diseases or highly communicable diseases, but we also have staff that have been specifically trained in the unit for this very circumstance.
Most importantly, Intermountain and Utah's Department of Health says there is no public risk.
And I just want to reiterate to Utahns that the risk to Utahns for COVID-19 still remains low.
Jorgensen just wants to get better. Now, doctors say that it takes 2 negative tests in a 24-hour period to be considered clear of the coronavirus. Now, Jorgensen's wife, Jerry, she also tested positive for it. She is still in a hospital in Japan, but doctors here tonight said that Jerry just had her first negative test of the coronavirus. No doubt her husband, Mark, who is here in the hospital tonight, is hoping the same thing happens for him soon. Dave, Mike, and Ashley.
Alex Cabrera live for us tonight with the KSL exclusive in Murray. Thanks, Alex.